it is with great pleasure that I'm here today to celebrate with you the World Menopause Day with the results of some of the studies that we have been carrying out at the Voice Lab at the Faculty of Education at UNED in Madrid, Spain, on the impacts of menopause on the voice. And in this particular presentation, our group would like to present the results of the development, validation, and implementation of menopause-related assessment scales for professional voice users. Yes, the voice also matters during the menopause, and it is the aim of this group and research project financed by the Atracción de Talento Investigador a la Comunidad de Madrid. We would like to give to professional voice users coping strategies to deal with voice changes related to menopause. Who are professional voice users? Well, they are those whose work depend on voice use and vocal demand, and they can be divided into 4 different levels. At the top of this hierarchical pyramid of needs, we have the level 1, those to whom even slight vocal difficulties impair ability to work. Among level 1 professional voice users, we have classical singers, singers from other genres, actors, radio and TV broadcasters. Then we will have level 2 to professionals to whom moderate vocal difficulties may prevent adequate job performance. And in this level we include teachers, public speakers, politicians, call center workers, clerical workers, salespeople, judges and lawyers. Then we will have level 3, to whom severe dysphonia impairs work ability. And those are counselors, psychologists, receptionists, public relations specialists, phone operators, and speech and language pathologists. And the rest of the professionals are those to whom work is not compromised even with severe vocal difficulties and are not considered professional voice users. They belong to level 4. Why studying the menopause? Why, we know that menopause inflicts self-perceived difficulties at work. Women during this period of reproductive life, that is the end of the reproductive life, may feel unsatisfied with the way that they are treated by their employers, or also less able to work because they have menopausal symptoms, among which vasomotor symptoms are the most reported and impairing ones. And to those who are singers and teachers of singing, some might experience a decrease in vocal range, endurance, and vocal full mobility. So, our research question is, to what extent can menopause lead to voice-related limitation to work and less self-efficacy in these female professionals to whom their voices are used as a primary tool of trade? In the first study we are today here presenting you, we wanted to assess self-perceived menopausal voice-related limitation to work in female professional voice users. Previous studies have shown that there are scales that measure workability as a function of general health, functional capacity, expertise, values, and attitudes. Examples of such scales are the Workability Index that were developed for the early identification of workers in need of health support, measuring self-perceptions of physical and mental demands of work, workers' health status, and resources. Other scales have been designed to assess the impacts of job performance and productivity on company losses. Examples of such scales are the Work Limitation Questionnaire that measures how chronic health problems and/or their treatment affect on the job work limitations. And also other examples are the Stanford Presenteeism Scale that has been designed to assess work limitation by assessing workers' knowledge and productivity. So we can see from this previous research that a lack of there's a lack of scales to measure work limitations specific to female professional voice users and menopause. So we designed it, validated, and here we present the results of the implementation of the Menopausal Voice-Related Work Limitation Scale, MENO-VWL, to assess the impacts of menopause on workability of those who rely on their voices as a tool of trade. This is quite important in voice education, because if you promote voice education for a voice healthy voice function, you will reduce greatly the amount of money loss due to work absenteeism related to voice problems. In this limitation scale, the MENO-VWL, we included questions that were focused on key aspects of workability. Those were occupational health, for which we included questions such as, I feel I need fewer hours of work because of my voice. Functional capacity, that included items such as, I can't use the entire capacity of my voice at work. Expertise, my voice restricts my work activities. Attitudes, my voice affects my decisions about my future career. Self-concept, my voice makes me feel incompetent. And self-expectations, my voice reduces the chances of getting professional opportunities. We targeted female professionals that were at the pre-menopause stage. We included 98 professional voice users from the 3 levels of professional voice users that I've showed early in this presentation. And in the premenopausal group, we distributed those professionals that were reporting regular menstrual cycles or episode of less or 3 consecutive months of amenorrhea. And for the postmenopausal professional voice users, we included those that were reporting to have 12 or more consecutive months of amenorrhea without surpassing 5 consecutive years. This was quite important because in such a way we followed the recommendations of distribution of women in pre- and postmenopausal groups according to the stages of reproductive aging workshop, and these are important because they help to minimize the confounding effects of aging in the menopause-related symptoms. What did we find? There were higher MENO-VWL scores for post as compared to premenopausal female professional voice users, meaning that postmenopausal women feel more work limitation as compared to premenopausal females. So the MENO-VWL scale is sensitive to self-perceptions of work limitation. The scores were generally low for both groups of pre- and postmenopausal female professional voice users, but we kind of expected that result because all of our participants did not have a medically diagnosed voice pathology, had healthy lifestyle practices, had voice education, had habits of warming up before going to work, had good sleeping and eating habits, good hydration levels, and reported no medically diagnosed reflux, which normally also affects the quality of the voice. Also, the limitation of work was perceived higher for pause as compared to menopausal female professional voice users. Why could that be? Because menopause has been associated with substantial voice alteration, so we kind of expected these results. But the effect size was small, so one might notice that there was an overrepresentation of level 2 professionals as compared to level 1. And in level 1, we include singers and actors that have very much experience with voice education, and that experience tends to increase awareness of voice use, improving the management of occupational voice related health and safety. In our second study, we wanted to understand self-efficacy with respect to menopause in professional singers. Why professional singers and why self-efficacy? Well, self-efficacy is quite important to musicians. It is determinant for aspirations, goal setting, life choices, and outcome expectations in the general population. But in musicians is a strong predictor of academic motivation, motor learning, and successful music performance. There is a great corpus of research on musicians' self-efficacy. Some studies have compared self-efficacy in music practice and degree programs, in jazz improvisation, in modeled instruction, in primary school music. Some have assessed the differences between university and conservatoire students, others in expressive performance cues and instrumental performance, but the literature lacks unvalidated self-efficacy scales that are specific to a music instrument and to neuromotor control of that instrument, in which case singing is not an exception. So once again, here we present the results of implementing a self-perceived scale validated previously for specifically female professional singers. And why is that? Because we saw that there was also a lack of validated scales reported in the literature. There was a singing self-efficacy scale for emerging adolescent males, but was non-validated. They want to assess self-efficacy during vocal development of male adolescent choristers. And these authors, Fisher, found that years of voice training impact more on singing self-efficacy than changes in voice quality caused by puberty. Also, this scale was implemented later on by Owen in female adolescent choristers before and after practicing a specific exercise regime, and the author found that older adolescent female choristers presented higher self-efficacy scores as compared to younger ones. We found one validated scale concerning voice self-efficacy, but this scale was developed and validated to assess the impacts of the use of specific terminology during voice therapy. So our scale, the singing self-efficacy scale, or shorter singing voices, wanted to include questions that were key in understanding singing voice function. So we designed these questions based on the literature concerning physiology of the singing voice, singers' vocal health, stages of singing voice development, singing achievement in examinations or in auditions. And the validation of this scale resulted into 3 dimensions: higher range and transitions, for which, for example, I can sing through the transitional regions of my voice with ease, constitute an example of the items included in this dimension. The second dimension was middle range. I can sustain a long phrase or note in tune in my middle range. And the third dimension, was the lower range. An example of an item included in this dimension was I can sing in tune in my lower range. So the scale was designed and validated around how the voice works concerning loudness, vocal range, voice registers, and breathing management. Once again, we use the stages of reproductive aging workshop as the recommendations for distributing our participants, that in this case were professional singers, into pre and post menopausal groups. And our results showed that there were scores of self-efficacy higher for pre as compared to post-menopausal singers for 2 dimensions, the high range and transitions and the middle range. You can see here that the scores of self-efficacy were generally high for both groups, but there is a clear tendency for having lower scores for high range and transitions as compared with the other 2 dimensions, and also that there is a significant difference between pre and post menopausal women, showed as dark green and light green respectively for the high range and transitions and for the middle range. And what can we learn from these results? That the fact that female singers present overall high self-efficacy was an expected result. Also, that the middle range and lower range dimensions presented higher values than the higher range and transitions, because singing at higher range and within the transition regions of the voice requires finer motor skills and are perceived therefore as a greater challenge by these professional singers. We also learned that postmenopausal professionals have a significant lower self-efficacy for high range and transitions and middle range dimensions, and we think that these results might be related with the fact that there is a lack of high-level solutions to cope with the challenges of dealing with a changing instrument, that is the singing voice during menopause, and less ability to perform well under this condition, and this may lead to progressive decrease in singing engagement, early retirement, and of course all factors related with a lower self-efficacy. We conclude that the more orientated the voice education is to the singer's individualities, the better the outcomes of voice pedagogy, decisions, and actions may be. This is our research group, myself as the PI, the principal investigator, then Núria Polo and Diego Ardura, my colleagues at the Faculty of Education and the Faculty of Philology in UNED, and my 2 research assistants and PhD students, Ana Ramirez and Mauro Fiuza. Thank you once again for your attention for the Programa de Atracción de Talento Investigador a la Comunidad de Madrid that made these studies possible, and others that you will hear during this day. And also, don't forget, keep your voice healthy, do voice education, because voice matters during the menopause. Have a wonderful World Menopause Day.